Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about common problems in Friedreich's Ataxia. Diabetes is present in 10 to 20% of patients and less than 65% have some degree of insulin resistance. Scoliosis is present in majority of patients, corrective surgery required in up to 50%. Urinary symptoms are common in adult patients, urgency, sphincter dyssynergia. Significant fatigue, impacting quality of life, is present in almost all patients. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about late onset of symptoms in Friedreich ataxia. Onset of symptoms is typically after 20 years, range 20-60 YRS, loss of coordination, ataxia. Progression is slower progression requiring assistance with ambulation, use of walker, scooter 10 to 15 years after diagnosis. Some individuals present with increased muscle tone, rigidity, and spasticity. Retained reflexes has been observed in some. Dysarthria is less severe. MRI studies show cerebellar vermian atrophy in about 50% of individuals. Cardiomyopathy is rare. Individuals with gait and limb ataxias, dysarthria, loss of vibration sense, and fixational instability after age 25 years should be considered for molecular testing for GAA expansion in the FXN gene. Late onset patient typically has shorter GAA repeat on at least one allele, shortest observed in symptomatic individual 65 repeats. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about genetic counseling considerations in Friedreich ataxia. Genetic testing results in 98% detection in symptomatic individuals. In rare cases, analysis of frataxin protein levels can be helpful to confirming or ruling out a diagnosis. FA is an autosomal recessive disorder with prevalence of approximately 1 in 50,000 in populations of European origin. Approximately 1 in 90 in those populations are heterozygous carriers of an abnormal FXN allele. Carrier testing is recommended for anyone with a positive family history of Friedreich ataxia and for partners of known carriers. Pre-symptomatic testing for at-risk siblings/relatives is available, however genetic counseling is strongly recommended to assist individuals/families in considering the risks vs benefits for testing an untreatable genetic condition. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about genetic diagnosis in Friedreich ataxia. Genetic testing is diagnostic in more than 98% of individuals. In more than 95% of abnormal alleles, the mutation is expansion of naturally occurring GAA repeat in first intron, non-coding region, of the frataxin or FRDA gene. GAA repeats, 3 to 33 normal, 34 to 65 pre-mutation, 66 to 1700, abnormal. Less than 5% of abnormal alleles have point mutations in the coding or regulatory regions of the gene. GAA repeat expansion sizes correlate with measures of disease severity. Disease range expansions diminish but do not eliminate frataxin expression. Genetic testing should be performed by an accredited laboratory. Genetist's website, a publicly funded medical genetics information resource developed for physicians, other healthcare providers, and researchers, available at no cost. Genetists hosts an international database of genetic testing laboratories. This information was taken from FARA Australia with their permission. Their link is provided in description. Hello everybody, welcome to Voices of Friedreich's Ataxia. Our goal is to raise awareness and funds to cure Friedreich's Ataxia, FA. Today we will talk about medical management in Friedreich ataxia. There are no approved treatments for FA, however proactive medical management of symptoms and maintenance of good physical and emotional health improves health outcomes. Annual neurological exam, treat symptoms, e.g., baclofen for stiffness. Annual cardiac exam with echo and EKG and Holter, aggressive management of early features of heart failure, understanding of diastolic dysfunction. Annual X-rays of spine. Monitor blood glucose and hemoglobin A1C. Annual ophthalmology exam. Audiology screening, not just a routine audiogram but tests able to detect auditory processing impairment. Annual flu shot. Physical, occupational, and speech therapy, preventive management of risks associated with neurological impairment. This information was taken from FARA Australia with their permission. Their link is provided in description.